Private insurance coverage, Rule 1557 and Trans Care in Maine. Brought to you by the Maine Transgender Network and the Mabel Wadsworth Center.
In June 2020, the Trump administration announced new attacks on trans healthcare coverage under the Affordable Care Act that would, according to the administration, allow providers, insurers, and hospitals to decline care to trans people because they are trans for religious reasons. In this video, we will discuss what these changes were, who they're affecting nationally, and how it will impact trans healthcare access here in Maine.
What is Rule 1557? It is part of the Affordable Care Act, also known as Obamacare or the ACA, and it made rules for discrimination protections under the ACA in two parts: medical services and insurance. Further, it required that private plans sold through the healthcare marketplace included coverage of transgender health needs. Additionally, Rule 1557 banned providers from discriminating against transgender patients, among others, in many settings.
Nationally, this policy change by the Trump administration harms many people. Trans people who live in states that don't have state-level discrimination protections in healthcare based on gender identity are particularly vulnerable. They're doubly vulnerable if they access their healthcare at religiously affiliated hospitals or religiously owned health insurance plans. These are the groups that are most likely to use this rule change to deny care access to transgender people. However, trans people across the country are impacted by this rule change because having the president back up discrimination only emboldens people who are already looking to discriminate against our community. We're glad to know that this rule change is being challenged in court, and we're optimistic, based on recent Supreme Court decisions, that we have a good chance of defeating it, but it will still do harm in the interim.
What does this mean for Maine? Luckily, we have several laws protecting trans people's rights here in Maine. Maine LD1, an act to protect healthcare coverage for Maine families, was passed in 2019 and enshrined a number of Affordable Care Act provisions into Maine law. Specifically, this included protections for trans people that had been part of the ACA and made them part of Maine law. This makes Maine more resistant to health and discrimination policy changes from the federal government.
We also have the Maine Human Rights Act. This is Maine's leading anti-discrimination law, and since 2005, it has guaranteed legal protections from discrimination based on gender identity and sexual orientation in all public accommodations in Maine. This includes healthcare settings. The Maine Human Rights Act is overseen by the Maine Human Rights Commission and is part of a fabric of laws in Maine that provide a couple of important rights for transgender Mainers when accessing healthcare.
In Maine, it's illegal to deny care to a trans person based on their status as a trans person. It's illegal for insurance to deny coverage based on trans status. This includes not only for gender affirming care, but for all care that a trans person may need. Healthcare providers, according to Maine law, cannot discriminate against someone because they are trans. All private health insurance plans in Maine must cover transition-related healthcare costs. And further, MaineCare, Maine's state Medicaid program, also covers trans care, including gender-affirming hormone therapy and gender-affirming surgeries.
Unfortunately, the law isn't always reality. Despite our robust system of anti-discrimination protections here in Maine, trans people still face discrimination every day, including in healthcare settings. In order to make sure that the promises of our laws are fully enacted and that transgender people are able to access all of the care that they need, we have to continue to advocate with insurance companies and healthcare providers to make sure that trans people will always receive culturally responsive and gender-affirming care in all settings.
If you've experienced discrimination as a trans person, please reach out to one of these organizations for help. You deserve access to safe and affirming healthcare.